Hello, Brian Perry here. For today's ANCOR Short Talk, we're going to talk about how technology helped an agency grow and save money. This is a 12-month case study between Rise Services and DCI. I'm Brian Perry, the Vice President of Sales for Direct Care Innovation. And for today's agenda, we're going to talk about what are the challenges associated with rapid growth? What technology do you have in place or need in place? What are the requirements for success? We'll look at the case study and see the results. And then what optimization can you make going forward? So when we talk about the challenges associated with rapid growth, this is especially important now as we come down from the mountain that was COVID-19. And so as agencies are starting to scale back up and see day programs open back up and other services and site-based services that may have been closed for the last year, you're going to have to onboard a lot of employees quickly. So how do you train those employees properly? What tech do you need in place? And how do you ensure that those employees are held accountable? How do you ensure that they're being properly supervised and their schedules are being maintained? And the key here is that you have a technology suite that's in place that can help you manage all of these things. So with Rise Services, we implemented a scheduling and authorization management so that they could trend utilization. They could see what was going on, how everything was working, and making sure that they were utilizing those authorizations to the max. We implemented the time and attendance solution for their employees so that those mobile employees and remote staff had a way to clock in quickly and easily with minimal effort so that you could capture accurate times and move away from paper time cards that have plagued so many agencies over time. We utilized a training and compliance tracking to ensure that staff and that's either newly hired or that was pre-existing were trained properly, compliant with the programs that they worked in. So we can ensure that for every program that someone's working in, they're properly trained, have all the correct compliance items that are needed before they go to work. And then we prepared for electronic visit verification and worked to ensure that we future-proofed that agency for ease of transition, for future mandates, for different state requirements, and just to help ensure you're ready to grow to the next level. And you know, I love this graph. Without a roadmap, how do you define success? And that's one of the first things that are required. So you have to identify what success looks like. If you're going to implement a software suite, whether it be DCI or anyone else out there, you have to make sure that you've identified what's important, what is on your roadmap for success. So, and how do those milestones look? As we started rolling out technology, Rise was instantly able to see optimization across their systems. An ease of implementation is great, but there's always challenges to training staff that's not technologically savvy. And this is really important to understand so that you can have a game plan for how to get those folks over the hump. As we're working with different care professionals throughout the country, we understand there's some difficulty in that, but it's important that no matter what software suite you use, you find one that's easy for your DSPs to work with. Make sure that, you know, even though your vendor has a plan, you have to have agency buy-in. You have to have those champions on your side that are there to help drive the ball across the finish line, to make sure that all of your milestones are hit. And again, that success roadmap is right where it needs to be. And when we talk about success, this is always a fun one to look at. So that kind of sums it up, right? We're going to get across that finish line and we're going to celebrate. And how do we celebrate? We look at what metrics we identified and how do we make those successful. So what were the results? These are some pretty great numbers. I have 20 or 30 more metrics along the same line. I just wanted to keep it short and sweet for today. But the biggest one was staff and billing time reduction. So payroll processing went from 5 days to 45 minutes. and billing processing went from 10 days to 4 hours. So effectively 15 full days, man days, shrunk down to a half a day. So that's an enormous amount of time saved right there. They were able to reconcentrate those same individuals to focus on care provision and ensuring that the individuals receiving service receive those services, maximize their authorizations, and are able to get all the care that they need instead of having to worry about meeting, remedial tasks. They were able to reduce unscheduled overtime by 67%, and then reduce denials to less than 1% of claims submitted. All those things above resulted in ROI of over $1 million a year. That's a lot of money on the bottom line for any agency. And Rise was great. They were able to give their caregivers a 12.2% raise across the board. So it's, the adage that DCI likes to live by, we're here to help you put more money in the hands of your caregivers. After your initial implementation and go live, it's important to have a roadmap for continued success and optimization. When you start looking at this, you need to look at the crucial job roles. Who were you able to save time with, and what can you get them doing to be more efficient, to help grow your agency, to help support those individuals that need our support. You have ease of onboarding with training for each program. It's defined and centralized. You're able to hire someone, assign them the training protocols that they need. They get those trainings delivered to them. They're able to take them, pass their tests, and start work much sooner and easier. You don't have to worry about scheduling classes for folks to come in, things like that. Again, whether it's DCI, and we'd love to have anyone on board with us, or any other provider, you have to make sure that you have an easy to use application for DSPs. If it's hard, if it's difficult or clunky, you're going to hear about it. It's going to make everyone's experience much less than desirable. So we have a platform that allows for ease of communication in critical areas, plus general messaging. We also empower people receiving support and their families by providing them with a portal to see information that they need to see in real time, and an easy way to communicate with support staff and agency representatives. And finally, optimization of authorization utilization, providing the correct amount of care on the individual's needs. And what we mean by that is really that if someone has an authorization, you want to maximize that down to the second if possible. You want to ensure that the individuals that are receiving service get everything that's due to them. They're the ones that we care about. That's all that we have to talk about today. I'd love to continue this conversation with anyone out there. Please feel free to reach out to me. Let's have this conversation. Let's talk about your software. Whether or not you use DCI, let's talk about best practices in the industry and how a software suite and a business management platform can bring your agency into the 21st century, produce recognizable ROI that allows you to get back to the world of caregiving rather than worry about administrative tasks. Thank you so much from us here at Direct Care Innovations. We love spending time with everyone at ANCOR. Wish we could be there in person. We're looking forward to seeing you next year. Have a wonderful conference, and please reach out with any questions.